The heart is one of the most important organs in the body, working relentlessly to enable the human cardiovascular system to function. The heart has 4 chambers, the upper right and left atria, and the lower left and right ventricles. In a healthy heart, blood flows in one direction through the heart's chambers. Delicate tissue-like structures called valves function to ensure unidirectional blood flow within. The heart has 4 such valves, which regulate direction of the blood flow. The mitral valve separates the left atrium from the left ventricle and is made up of 2 thin flexible flaps called leaflets. When freshly oxygenated blood from the lungs returns to the heart, it enters the heart through the left atrium. Left atrium relaxation causes the mitral valve to open, enabling blood to travel into the left ventricle. When the left ventricle contracts, the mitral valve closes to prevent backflow. In some people, the mitral valve doesn't close tightly, causing mitral valve regurgitation. When the heart beats during contraction, the blood from the left ventricle can flow back up to the left atrium. Mitral regurgitation, MR, can be subdivided into functional and degenerative subtypes. Degenerative MR, or primary, results from anatomical abnormalities of the valve itself. In most cases, the chordae connecting the mitral valve to the papillary muscle rupture or elongate, causing leaflet prolapse. Functional or secondary MR results from the left ventricle dilation stemming from cardiac arrest or heart failure. MR is a progressive disease which, if left untreated, can initiate a series of events culminating in heart failure and death. Current guidelines recommend surgical mitral valve repair or replacement in severe MR patients. For MR patients for whom surgery is not an option, minimally invasive procedures are available. MitraClip is a unique, highly maneuverable transcatheter system for mitral valve repair. This procedure avoids cardiopulmonary bypass using minimally invasive venous approach and transseptal puncture to gain access to the left atrium. MitraClip's steerable guide catheter is introduced over a previously placed guide wire. The dilator is used to gradually advance the guide into the left atrium, and the guide wire and dilator removed. The clip delivery system is advanced into the left atrium, positioning the clip above the regurgitant jet and perpendicular to the mitral valve plane. Inside the left atrium, the clip arms are open to 180 degrees and positioned perpendicular to the line of coaptation before crossing into the left ventricle. The clip is advanced into the left ventricle below the valve leaflets and retracted to grasp the leaflets. MitraClip grippers are designed to drop firmly into the clip arms, securely capturing both leaflets. Once the arms are closed, they create a double orifice within the mitral valve. Prior to clip deployment, echocardiographic imaging is used to assess procedural efficiency and leaflet capture. Prior to deployment, the MitraClip can be released and repositioned for optimal MR reduction. Once achieved, the clip is released and the full system retracted. In most cases, the transseptal puncture reseals itself and tissue ingrowth between the clip arms increases, facilitated by the polyester clip covering, which promotes healing to create a fibrous tissue bridge between the leaflets. The MitraClip procedure is a minimally invasive, highly effective treatment option for select patients with severe MR.